The hearing aids are not just for you to hear better, but they're for you to communicate better, they're for improved quality of life, and to get you back into the normal routine and to also prevent future issues. So getting that stimulation back, treating the hearing loss is going to help long-term reduce risk of falls, it's going to reduce risk of cognitive decline. So just getting him back to improving the quality of life is what this whole process can provide. Hi, I'm Dr. Kathleen Coates. I'm the owner of Coates Hearing Clinic. I'm an audiologist, and I'm going to talk to you today about what goes into a hearing aid fitting appointment. So prior to a hearing aid fitting appointment, we perform what's called a communication needs assessment. This is typically part of their new patient appointment where we go through the diagnostic tests, we review the results, we talk about hearing aids as the next treatment route based on the type and degree of hearing loss that they have. And then the communication needs assessment will lead us into what the goals are for the patient with a hearing aid treatment plan. Not only what we recommend based on what we found, but also setting up goals for the patient. Everyone has different needs and different goals, different lifestyle, different vision or dexterity concerns. So we go through a lot during that appointment. When we set up the goals for treatment, talk about why the patient came in initially. And typically it is, I can't hear my spouse, or my friends have told me that I can't understand what they're saying, or their television volume is starting to be increased over time where they turn up the volume, it makes it louder, but it doesn't necessarily make it clearer for the patient. And one of the biggest problems I think that patients have is hearing not just in a quiet room, but hearing in the real world. It's a noisy world. So hearing in group settings, family gatherings, church, places that it is more challenging to hear can be that kind of initial red flag or sign that there might be some change in hearing. The most common type of hearing loss can happen just so very gradually over many years. So by the time patients come in to get tested and by the time they come in for this hearing aid fitting appointment, it's been a long journey. So I think being able to walk them through each step in the process, and then I think it's important for the patients to understand that it is an adjustment. It's a process. It's not just, here's the devices, send you on your way. It takes some time. It takes some time and effort on the patient's end. It's important for us to make sure the patient understands the full process. When a patient comes in for a hearing aid fitting appointment, one of the biggest focuses for us in our practice is to educate the patient on the treatment plan, making sure the patient fully understands what is involved, and then also feel like they have this local provider to be able to support them through this process. It can be a lot of information, so we want to make sure that it is smooth and that the patient is going to get the most success out of treatment. So first, when we sit down with the patient during this appointment, we want to make sure we review any other follow-up questions from what we talked about during their communication needs assessment or new patient appointment. We'll look at the hearing aids and just kind of show them what they look like. We've already picked out a style of hearing aids. We've already picked out a level of technology. So we review that information with the patient. And also what we'll do is fit the devices specifically to their ear. There's lots of different pieces and parts to the hearing aids, and during this fitting appointment, there are hundreds of different styles and shapes and types of tips that go on the hearing aid. Part of that is based on the patient's ear anatomy. Part of it is based on their hearing loss to make sure they're going to get the full benefit out of the hearing aids day to day. Once we get the devices fit based on the patient's ear, we'll place it in their ear. We will run through a few measurements to make sure it's nice and secure in their ear, making sure that as they talk and they chew and they go about their day, that it's going to be comfortable and secure in the ear, so the patient's not going to have to worry about it coming out or anything like that. That's a normal part of the adjustment process that we walk the patient through. After that, we're going to run through some calibration tests. Here at our clinic, we have equipment to run what's called real ear verification measures. These are very important as part of the fitting process. This is to ensure that even if the patient has the same exact hearing loss as someone else, they have different ear canals. They have different shaped ear canals, they have different needs. So the calibration is to ensure that it is performing in their ear specifically the way it should. These devices are prescription. So based on the hearing test, we want to calibrate at each frequency the amount of gain, the amount of sound that the patient needs to bring them back up to getting the full benefit out of it. Not many clinics have this type of testing. Less than 40% of clinics have it. But the research shows that if you run this, that the patient's going to have better long-term success with it and also perform better in situations that are more challenging. So in a quiet room, it may be easy, but when you go to a restaurant, group settings, church, places like that where the hearing aid needs to do more work for you, we're going to make sure that you're getting the full benefit. My favorite part about the fitting is activating the devices. So when we first turn them on, it's just incredible of the type of sounds and the type of feedback we get from patients to say, what's that noise? Or what's that in the background? Or their loved one sitting next to them that starts to whisper or say something to them, and they turn their head, and you could just see their face light up that this is how I should be hearing and this is what I've been missing. So as part of that fitting process, that's my favorite part, just activating it, turning it on, and then walking them through it, walking them through, these are the types of sounds you should be hearing, but you haven't been hearing probably for a long time, or just haven't been hearing as crisp or as clear as you should. I always tell patients that the goal for day one with hearing aids is to start where it's noticeable but comfortable. We don't want to turn up all the sound right from day one because it could be overwhelming, especially depending on how much hearing loss that's there and how long that the patient has been experiencing problems. We want to gradually reintroduce those sounds, and that helps make it a smoother process for the patient to go about their day-to-day life, to see what they're noticing, to test out in all different situations. And by the time they come back a couple weeks later, they will have already adjusted to having something in your ears. So to be able to come in and say, I'm doing better in this situation, but how can we adjust for this or that? The patient will get the most benefit out of the hearing aids once we get them to their full prescription. So usually that takes about 1 or 2 follow-up visits to get to that level, to where the patient can get the full benefit for long-term care. Having that local provider and having a doctor of audiology who is there to support them throughout the whole process is something I want patients in our community to understand. That the devices themselves, the technology is amazing, it's great, but it has to be fit just right. And so we're here to support the patient throughout the process, to work with the patient at their follow-up appointments to say, doing well, but I'm still having trouble here or there. There's a lot that we can adjust and take care of for the patient, to work with them specifically on what we know and what the research can provide as adjustments and fine-tuning over time. And then we also set up a care plan depending on, their insurance and coverage, but the care plans, what I've found in my experience, are very important as far as the long-term success with hearing aids. So for a lot of patients, that knowing they have this care plan involved with this part of treatment, that they can come in anytime they need anything, if they have questions, if they need some extra support with cleaning and maintenance, if they're having any issues with them, to know that they can come in and get the help that they need. There's all different types and degrees of hearing loss, and so for patients who have anywhere from mild degree to severe to profound hearing loss, there's a different device for everyone. And for our clinic, we also are a full service clinic. So if a patient starts with hearing aids and they have gradual significant decline in hearing over the years, to be able to evaluate and look towards the future to say, okay, hearing aids may not be providing the most benefit for you now. We need to enroll you in some other type of auditory rehabilitation therapy. And then also looking towards the future too, if the hearing loss gets to the point where the patient might be evaluated for a cochlear implant. So we do all the evaluations for that here over the years. So if a patient's not doing well with hearing aids, that could be the next step down the road.